Hi, my name is Dr. Justin Dorenzo of Dorenzo Psychology. I am a forensic and clinical psychologist. I want to share with you about issues of consent for minors regarding healthcare, specifically psychological services in divorce and separation cases. Our practice is presented with children and parents in all types of situations, and our practice manages both forensic and court-ordered services, but also clinically based services. During this discussion, I am speaking specifically about clinical services, such as when a parent brings a child or children to our practice voluntarily seeking help for them. Although one would assume this is a harmless scenario in nature, a parent that's no longer in a relationship with the other parent who brings a child for psychological or educational services is one of the most potentially challenging situations that our practice faces. Usually, both parents are in agreement when their child needs help, but often there is disagreement about what the child needs. Examples include only one of the parents believes their child has ADHD, a learning difference, or anxiety. Or in other cases, parent A believes they are being alienated from their child by parent B, or maybe parent A believes parent B has a drug problem, is abusive and neglectful, or has a psychiatric problem, and parent A wants the child to report it to the psychologist or the therapist. Now, in these cases, sometimes there's a genuine concern for the child or the other parent, but in many cases, parents bring their children to our practice to bolster their legal case. When the latter occurs, our desire to serve children becomes rife with challenges. And rather than helping children, our practice has found ourselves in legal disputes despite our best intentions to help a child. Divorce statutes and parenting plans are not perfect and often leave out important guidance. And parenting situations certainly change where one parent may later decompensate or a true latent problem later manifests and parenting plans need modifications. Florida parenting plans must designate who will be responsible for any and all forms of health care. Section 61.132B3 Florida statute states, if the court orders shared parental responsibility over health care decisions, the parenting plan must provide that either parent may consent to mental health treatment for the child. Truthfully, I have never seen this statement in a parenting plan. Further, if the court does not order shared parental responsibility over healthcare decisions for a child, the requirement that that parenting plan provide either parent may alone consent to the child's mental health treatment does not apply. It is rare, though, that someone without sole parental responsibility or without shared parental responsibility will bring a child to our practice with concerns about the other parent, although sometimes that does happen. To ensure that everyone follows their court order and keeps us in the position of helping your child rather than being ensnared by two highly conflicted parents, we have added verification sections to both our child consent form and the child questionnaire that parents complete before their child is seen at our practice for clinical child non-court ordered therapy and counseling services. As of September 2020, in summary, we have something like this. Now, you see our website for more details too. On the form, we now require verbal and written verification that the other parent or guardian also knows and consents to the child receiving services being requested at Dorenzo Psychology. We instruct you to provide a court order or consent that you must inform the provider during the intake if you do not have authority to consent alone, that we will not be held responsible if you are dishonest with our practice, and that we reserve the right to terminate services if treating your family becomes disruptive to other patients and clients at our practice. I hope this offers some guidance before bringing your child to any mental health professional if you find yourself concerned with your child's psychological or psychoeducational well-being. If your child does need to be seen, the best course of action is to get documentation of the other parent's consent prior to contacting our office. If you have additional questions, contact us by phone or email or speak with your attorney. Thank you very much.